Hi, everyone. Welcome to Scotty Sports Psychology's webinar on sports psychology and injury recovery. I am Erin Ayala, and I'm going to be walking you through some of my research and some of the upcoming things that we have here at Scotty Sports Psychology. So, to get us started, a little bit about myself. I use she, her pronouns. I'm based here in the Twin Cities in Minnesota. I am a licensed psychologist, and I'm also a certified mental performance consultant, which is a special certification through the Association of Applied Sports Psychology. On top of that, I'm a member of the U.S. Olympic and Paralympic Committee's Mental Health Registry, which basically is a group of vetted providers who have gone through safe sport training, background checks, and other background just kind of measures to make sure that we have experience working with pro elite athletes and that we know what we're doing. And then I have what's called a PsyPact telepsychology license. So this is a license that allows me to practice as a psychologist across state lines in over 40 states in the US. I'm the founder and owner of Scotty Sports Psychology. Scotty was named from Norse mythology. So Minnesota, we've got a lot of Norwegian roots, and Norse mythology and the Vikings are a part of that. Scotty was a Norwegian goddess or giantess, often depicted with snowshoes, bow and arrow, skis. She was known for her fierce independence and her ability to really thrive in harsh winter environments. And she is known as the goddess of mountains, ice, and snow. So Scotty is a nod to all of the female athletes I work with in ice and snow sports here in Minnesota. What we're going to talk about today is injury rehab. This is the topic that I've become really passionate about for a lot of different reasons. When we look at the research, we know that about a third, less than a third of athletes use mental skills during their injury rehabilitation process, and only 3% learn mental skills from a sports psychologist. However, 72% of athletes believe that mental skills really have helped them rehabilitate faster. So when I first saw this statistic, I was like, wait, does that mean that nearly 30% said it wasn't helpful? That wasn't the case. 14% didn't respond to that question. 14% believed the sports psych did not make the rehab process faster for them. So today, we're going to debunk some myths and misconceptions about injury rehabilitation. I'm going to talk about some important pain points that athletes are likely to experience during injury. And then I'm going to talk about the research that says what we can do about it to use sports psychology skills to basically stay on top of your injury recovery game and set yourself up for a really strong comeback. So some important myths and misconceptions that I want to run through with you. There are definitely more than this. These are three that I come across most often. The first one is that complete rest is always best. And kind of this fear of doing anything, frankly, because you don't want to make things worse. And this is warranted because we're scared often to move and groove too much, and we want to stay within the guardrails that our PTs set for us. That being said, it is really important to be willing to go outside of your comfort zone. Motion is lotion. It's important to stay active. Stay within the guardrails that your healthcare team sets for you and your physical therapist, especially, or your surgeon or others. So if they tell you that you're not going to be ready to do something, obviously don't do it. That being said, it's important. It's really, really important to stay active and engaged, especially with your PT exercises. Because if you're not using those muscles, those tendons, those ligaments, those bones, whatever else is injured, you're not giving them the opportunity to start to kind of like stress and then recover from that movement process and that strengthening process. Another really common misconception that I hear is that injury is purely physical. It's just about getting the work in. And the physical work is very, very, very important. That being said, the mental game is really important as well. I wish that more athletes would spend more time on their mental game because this is something that I think that they'll often realize further down the road that they might be struggling. And then they don't necessarily have the tools, tips, or techniques needed to really cope appropriately. A quick example is, let's say you have an athlete who's feeling flustered or worried about getting back to training, and then they see something on social media about the upcoming season and they start to feel anxious and rushed. And then without even thinking about it, they decide to like push themselves and go for a run or get an extra workout in or do something they wouldn't typically do because of that emotional response. Exercise is often a coping mechanism for athletes. So then when we're not able to exercise anymore as our coping mechanism, we can get stuck. And so in the case of injury, you can just set yourself up for more setbacks and re-injuries if you're not really listening to your body. And sports that can help you with those types of things. Third misconception is that a faster recovery basically means you're going to have a better outcome. That's not the case. Some athletes might say, oh, I'll do twice as much so I can get better twice as fast. That's not going to happen. You've got to be really careful and trusting your care team to make sure, again, you're staying within their guardrails and following their guidelines and holding true to their process. And so when thinking of faster recovery may mean that you rush the process. It might mean that you are also really, really diligent and conscientious with your PT. That's the case. Awesome. But faster isn't always better. Patience is often really, really good for injury rehabilitation and really trusting that process and taking it one step at a time. So these are some of the common misconceptions that come up in my work as a sports psychologist. Another thing that I want to touch on is common pain points. And then I'm going to kind of dive into the research and what we know about injury rehab and what athletes can do to really maximize their injury rehabilitation process. One of the first common pain points that I see is just understanding different types of pain. It is really difficult to know what is considered healthy or appropriate pain and what's not. It's hard to know at what point does pain become chronic pain. So I think of folks with like post-concussive syndrome, tendinitis, tendinosis, bone stress injuries. When it's really kind of hanging around for a long time, it can be really difficult to adjust. The human body in general is designed to protect us from pain. We don't like it for good reason. It's a warning sign to us. And what can happen during the injury rehabilitation process is either we overanalyze it and we become really hypervigilant, or we try to ignore it altogether. And it's really important to stay open to it and curious without judging it. So this is easier said than done, but your care team can help you with this. This is something where sports psychology can really come in handy, is being curious about the type of pain that you're experiencing. Is it a searing pain? Is it achy? Is it deep? Is it stinging? Is it in one specific location or all over? Is it dull? Right? There are so many different words that you can use to describe pain. And rather than just assuming that it's a bad thing, think about what it actually means. Again, talk to your care team about what makes sense and like what type of pain is okay for you to feel and what type of pain you shouldn't feel. Like tightness or ropiness might be pretty common following a surgery, for example. Like a hooking sensation, that's something that you're going to want to tell your PT team or your surgeon or your healthcare providers about. So be careful about kind of understanding what it is, stay curious, stay open, and then worst case scenario, share with your care team what you're feeling and they can help you interpret it if you're not sure. Another really common pain point is setbacks. The injury process is not linear. And I think it's not that we always expect it to be, but we don't always plan for these setbacks because we don't want them to happen. So one thing that can occur is where athletes will consistently start to get better and then something hits the fan and it changes. And it's like two steps forward, one step back. Either pain returns or a different area of your body starts acting up, or all of a sudden things get really tight and it affects your range of motion, or you were able to do a certain thing in PT last week and now you can't for one reason or another. These setbacks are expected, they're inevitable. And so it's really important to be able to plan for them. Obviously, we don't know when they're going to happen, but we know they're going to pop up at some point. Just like physical performance and athletic performance, we're not going to get better and stronger every day. Some days are going to be better than others. The one thing that I often say is like, no matter how good or bad you feel, it's not going to last. Right. And so think about the good days, like soak them in, enjoy it, but also know that they're not always going to be like that. And then same thing for the bad days. When you're really struggling to get through your PT exercises, for example, or even struggling to pick up like the resistance band and do your PT exercises, not every day is going to be like that. So take it one day at a time and remind yourself setbacks are inevitable. A third common pain point that I see is a sense of isolation. This is really big for athletes because, and this gets into the next one as well with athletic identity, a big part of who we are is an athlete. And so what can happen is our friends, our teammates, our coaches, our social support network often surrounds that specific sport that we're involved in. And so then when we're injured, we're not spending as much time with them, or we don't want to because it's a reminder of what we can't do. And so isolation is really common. And it's often like we do it to ourselves because we don't want to put ourselves in a situation where we're going to be reminded of the things that we're not able to do. But that isolation is also making it worse because we know how important social support is for the injury rehabilitation process. We have to be able to lean into those relationships that we have with our community, our teammates, our family, our girlfriends, boyfriends, partners, etc. So when you catch yourself isolating, do yourself a favor and call yourself in and being like, okay, what's the best thing that I can do for myself right now? And start there. Fourth pain point, not the final one, because there are a lot of pain points when you're injured. But the fourth one that often is pretty common is the sense of athletic identity and how it really takes a hit because we are so focused on growing and improving and seeing progress in sport. And then you take that away, and there aren't like, we don't know what's left until we really start to look for it. So it's important to be able to lean into different aspects of your identity. This is easier said than done because of course when you want something is when you can't get it. And so when you can't have sport is when you're going to want it more. And it's there's a grief and loss period for sure. And so I often say to athletes like ride the waves. And so when it comes to athletic identity, ask yourself who you are outside of sport. It could be relationships with like family. Are you a parent? Are you a child, a sibling? Thinking about your loved ones, thinking about your peers, your community. If you have a strong faith or spirituality, that could be a part of your identity. Other communities that you spend time with, right? So if you're a member of the LGBTQ community, thinking about that as a part of your identity. So make sure that you're kind of spread the love in a sense where it's not just about sport anymore. It's about other things that you can do. This is tough, but I often say, like, try to think about other things that you've been neglecting unintentionally or intentionally while really leaning into your athletics like other hobbies that you might have liked in the past that you just don't have time for anymore, other adventures that you might like to go on. So, athletic identity is really important. You have to spend some time kind of stepping outside of the box and thinking more about how you want to spend your time, knowing it can't all be in sport. So, what I did in order to kind of dig into this is I'm a former professor. I used to do a lot of research and publish a lot of research, and I still do. And so one of the things that happens is athletes get this usually like a physical training plan for return to play, but not a mental one. And they can really struggle because they want this sense of structure and they're not sure what to do from a mental perspective. Like, should I be like journaling? Like, should I be meditating? Should I be setting goals or should I not be setting goals? What should I be doing? And unfortunately, there aren't a lot of resources out there. There's a good amount in sports psychology, but they're kind of siloed where they'll talk about social support or adherence to your training plan, goal setting, visualization, but there aren't a lot of holistic models. And so what I did was I went to 43 subject matter experts. We got physical therapists, psychologists, athletic counselors, physicians, chiropractors, you name it, lots of different healthcare providers, sport dietitians. And I gave them this prompt that's in front of you on the screen. I said, reflect on your experiences working with injured athletes over the past several years, including the most and the least successful rehabilitation cases. What are the actions, thoughts, and feelings that contribute to optimal mental health, recovery, and future performance for injured athletes? And then I had them finish the sentence. To have an optimal injury rehabilitation process, athletes should dot, dot, dot. So this is a really cool process because it's all online, it's remote. So I have this interdisciplinary sample and it's basically like an online focus group. So I give them this prompt, they log into this portal and they start adding things. So they might say like, be patient with the recovery process, enter. That is then added to the left side of the screen, and other people who log in can also see it. So it's kind of like a focus group in live time or real time. And as people come in, they can see each other's ideas and then work off of them. So we got, I think, close to 200 responses from these different subject matter experts. And so then I cleaned and kind of aggregated and coded the data and we simplified it and got it down to 99 items. So then I went back to the subject matter experts and I said, okay, now look at this group of 99 items. I want you to place them in categories or piles based off of conceptual, like similarity or meaning to one another. So if two things are alike or similar to each other, put them in the same pile. If things are different, create different piles for them. So you might have a pile for like nutrition, one for sleep, one for physical therapy, one for friends. So all the subject matter experts did this. And then I gave them the data again. And I said, I want you to rate how important each of these items is for injury rehab on a scale of 1, not at all important, to 5, extremely important. And then I want you to tell me, how challenging is it in general for athletes to do each of these things on a scale of 1, not at all challenging, to 5, extremely challenging. And then we looked at the data and we were able to see what are the most important, least important, most challenging, least challenging things that athletes should do for their injury rehabilitation process. We got it down to 8 categories. So I'm going to walk you through each of these categories right now. We've got healthcare team, sleep and nutrition, goals and accountability, physical rehab, which is really like a gradual return to training, got mindset, which is really focused on resilient and having a resilient mindset, holistic healing, which includes stress management, self compassion. We'll talk more about this one, and then having a good social support network. So I'm going to walk through each of these so that you can get a feel for them. So the first one that we got was sleep and nutrition. This was really cool because I know we would not have necessarily gotten this if it weren't for the dietitians and some of the other folks that were in the group who contributed to this research. So the sleep and nutrition piece is really talking about the importance of having a solid nutrition game, knowing that, like, for example, a calorie deficit is not a great idea when you're injured. A lot of athletes feel like they shouldn't eat as much because they're not working out. That is not true. Athletes really need to focus on protein, getting plenty of carbs, and then thinking about potential supplements depending on the type of the injury. Work with a sports dietitian to do this because they can help you with this process. Sleep, also super important. Sleep is when our muscles come in and really start to repair and reconstruct. And so thinking of the benefits of the PT, you're not going to get those full benefits unless you're getting a full night's rest. So sleep is really important. The second category that came up was social support. So we need to lean into our social support network, family, friends, teammates, peers, coaches, people who are in our corner. We have to accept help from them. We have to ask for help when we need it. It's important to stay involved in the team or your community if you're able to. It depends on what that role might be. So let's say if you are, I work with a lot of endurance athletes. So let's say you're an endurance athlete, you had registered for a triathlon, you're not able to compete. Well, can you still go to the event and volunteer? Right. And so try to stay involved and stay in touch with your network, because if you just isolate, you're not going to be helping yourself. It leads to more feelings of depression and anxiety. So the third category is a gradual return to training or physical rehab. This can be a tough one because this really talks about the importance of listening to your body and really thinking about, how is it responding to PT? How is it responding to the treatment? Approaching it with curiosity, not judgment, and trying to figure out how you need to kind of adjust and modify your PT if needed. So the gradual return to training also means focusing on like proper strength training, really sticking to the plan that your physical therapist or your other healthcare providers give you and following their advice, and then communicating with them if something doesn't feel right or something's not going well. Fourth category is having a trusted healthcare team, interdisciplinary, sports dietitian, sports psychology, physical therapy, strength and conditioning, surgeon, athletic trainer, you name it. You need to make sure that you trust your providers. This is really important to get a second opinion if you need to. But by doing this, you can have you can be an active participant in your own recovery process and really lead the way. You can communicate with them, talk about how you're doing, modify things as needed so that you really do feel like you are a member of that team and they're not just telling you what to do. You want to make sure your providers have the same goals as you and they're not going to just tell you to stop playing your sport. You want to make sure they're going to work with you, right? And give you good guardrails and knowing like your vibe and what you're going to want to do, what you'll be compelled to do. They'll tell you whether or not it's appropriate. Okay, we got 4 more. Goals and accountability. So this is really important. Athletes have to set milestones during their rehab process. I talk a lot about this with my athletes. So it's not just about the nature of like getting back to play or full contact, for example, at practice or in games. It's all of those little things along the way. We have to celebrate small wins. So examples I often provide are like putting your hair in a ponytail for the first time, being able to drive for the first time, going up or down steps for the first time, being cleared to lift more than 10 pounds. What are all of those little milestones that your PT is kind of like working toward for you? Make sure that you set milestones. And if you're not sure what they should be, work with your healthcare team to do it. Help them identify like what you can be working toward. That's really important for the motivation side of things and maintaining a positive and a resilient mindset. Speaking of which, resilient mindset, this was one of the most challenging. This one and self compassion were the most challenging out of all eight, which is not surprising. And this is really talking about like how to be patient with yourself in the process, being an advocate for yourself and your recovery process, thinking about the big picture, not just the next race or the next event you're registered for that you're not going to be able to participate in or that you may or may not be able to do, right? The unknowns can be really difficult for athletes, and it can be tough to maintain a resilient mindset when you don't know what's going to be around the next quarter. And so you have to be patient with yourself. You have to be gritty and persistent and passionate. Remember your why. Remind yourself that recovery is not linear. There are always going to be ups and downs, and it's important to come back from them. But this isn't kind of like the mental toughness, ignore your emotions and thoughts along the way. I always say bring them along for the ride because they're going to show up because you care. So check yourself and your mindset. The resilient mindset is really important in trying to maintain like a positive or healthier, optimistic perspective. I often say to athletes, both things can be true. So, like, yes, it sucks. And I'm confident that you can do it. So, you have to remind yourself both things can be true. I can be frustrated. I can feel all the feels, and I can still show up and do the hard things. Okay. Number 7, self compassion. Athletes in general have a hard time with this one because we're afraid that we're going to like go soft or become complacent or we'll lose our edge or we'll lower our standards. Those things are not true. With self compassion, it basically means being mindful and aware of what's going on for us in the moment, how we feel about our body, our environment, our thoughts, our feelings, just being aware of them. It also means knowing that we're not alone. As humans, as injured athletes, we're not the only ones who feel this way. It's part of the human experience. And then the third piece is giving yourself a break. And it's that kindness, not beating yourself up. Because if you are too busy beating yourself up for something that happened, you're preventing yourself from learning from it. Because if we're so focused on what we didn't do or what was wrong, we're not focusing on what we can do differently next time or how we can be better. So don't prevent yourself from that opportunity for growth. That self compassion is really, really important. And then the last one is whole body healing. Really, what this comes down to is stress management. Don't run yourself into the ground. We have a lot of appointments. We're going to a lot of meetings, a lot of phone calls, check ins, things that we have to deal with, paperwork, right? And so you have to keep the bigger picture in mind. Think about maintaining a positive and an optimistic attitude. And then think about like long term, what does this mean for you? And have a plan of exit from sport if needed. That's something that we often don't talk about and we just don't do as athletes. Make sure that you have a plan for when you are no longer performing at the level you're at. What are you going to do differently? And this is a really great time to start thinking about those things and to start planting those seeds. Each of these bullet points, these are some of the common things that came up in the research by the subject matter experts. So, and this is something that's important because sports psychology can help you with these things. All of these tap into those 8 categories that we just covered. You can learn how to advocate for yourself. You can learn how to listen to your body, give yourself grace when needed, be patient with the process. It helps you look at the bigger picture and maintain perspective and figure out your why. A lot of the work that I do with athletes is kind of figuring out what is your why? Why are you showing up? What are you doing on a day to day basis? What motivates you? And then giving them different kind of markers and milestones and goals that they can work on that they feel really good about because it's not just about their performance or their metrics. It's about who they are as a person. And then they're proud of who they're showing up, how they're showing up. And that makes life a whole lot easier. So sports tech can be helpful with that. It's also really helpful for managing the roller coaster of emotions because you might feel really, for example, jealous or envious when you see teammates or friends going out and doing this thing that you can't do. Sports psych can help you make sense of those emotions. You might feel anger, resentment, sadness, frustration, guilt. Sports psych can help you process those emotions, make sense of them, and then figure out what to do with them or about them. I think another thing that's really helpful is this piece on it's the bullet point toward the middle is recognize when you're focused too far into the future, or if you're focusing too much in the past. We can help a lot with paying attention in the present moment, and as cheesy as it sounds, it is wildly helpful. There's an acronym that I often use. Ironically, it's WIN. What's important now? And for injured athletes, this can be really difficult because again, it feels like such a slog. And so it can be a matter of kind of keeping you in check and helping you navigate the ups and downs of the recovery process. We can also help by helping you like self compassion, journaling exercises, mindfulness, meditation resources, giving you kind of that structured plan. That's really important. And there are a lot of ways that you can do this. Kind of like working out, the best exercise is the one you'll do. Similar to sports psychology, the most effective tool is going to be the one that you can do consistently. We know sports psychology works. We know it's really, really effective. The research shows it anecdotally, clinically. I see it all the time. We know that it's really helpful. That being said, it's just like fitness. Whereas if you like binge and read a big self help book over the course of the weekend, can you get something from that? Yes, for sure. But it's not going to be nearly as effective as if you do like one chapter a day for 2 weeks. That consistency can be a game changer because then you're always thinking about these concepts and you're more likely to then notice them when you do this thing. And then you'll be like, oh crap, I just read about this. I'm doing that again. Right. So it can be really great for that self awareness and identifying some of your coping patterns and coping behaviors. What are the ones that are really helping you? And what are the ones that are not necessarily helping you? So sports tech can be great for that. And then I think the other thing I'll say is really just identifying some of those opportunities and where can you direct your energy other than the injury rehabilitation process. We can help you kind of find some ways to keep yourself busy and fulfilled to help you thrive in a way that you may not have expected while you're injured. Because when we're injured, we're so focused on how we're feeling, the next milestone, what we can't do, we forget to look at that bigger picture, right? So this is a nice summary of some of the research that I've done in the area. This isn't yet published. So mum's the word. We're writing up the manuscript right now for publication. And what we'll be doing is talking about these 8 categories and really what that means for sports psychology providers, healthcare teams, athletes alike. And then we're also building up a course, which you'll hear a lot more about in the coming days and weeks, called the Mindful Comeback, where we have 8 different modules that walk through each of these different lessons, in addition to what we call the Injured Athletes Toolbox, which is 6 modules that talk about a lot of these things that sports psych can help you cover. Fear of re-injury, dealing with difficult thoughts, difficult emotions, difficult situations, right? We help you navigate those types of things as an injured athlete so that you have kind of that mental game plan that you're working toward. So this is all I have for you today. I'm including my contact information here. You can find more information about Scotty Sports Psychology, about athlete injury, about the course on my website. It's scottysportspsychology.com. Instagram is kind of the best place to find me. We post every day, all the time. We're really active on Instagram. We have a good presence and really great community there. And we're going to have a lot of injury content coming forward in the next couple of weeks and months. And then finally, my email is at the bottom right, erin@scottysportspsychology.com. If you have any questions at all, don't hesitate to reach out either via Instagram or email or the website. Thank you so much, everyone. Thanks for being here. Take care.